Hi, this is Andrea Kane, and I'm back again to talk to you about The Language of Medicine 12th edition by Davy Ellen Chabner. And we are now on Chapter 2. This is HSC 114. And we are on terms pertaining to the body as a whole. We have lots of slides to get through, so I'm going to move through these much more quickly than I did with Chapter 1. Our chapter goals for this one are to define the terms that apply to the structural organization of the body, identify the body cavities and recognize the organs contained within those cavities, locate and identify the anatomical and clinical divisions of the abdomen, and locate and name the anatomical divisions of the back. We also want to become acquainted with terms that describe positions, directions, and planes of the body, identify the meanings for new word elements, and use them to understand medical terms. And although I did not do this in the first video, I'm going to really quickly go over what our learning objectives are for Unit 1 in our syllabus as we talk through chapters 1, 2, 3, and 4. So as you study chapters 1 through 4, keep these in mind. We want to identify, define, and spell the meaning of basic combining forms, prefixes, and suffixes of the medical language. We want to correctly spell medical terms, divide medical terms into their component parts, analyze medical terms that combine prefixes and other word elements, build medical words using combining forms, suffixes, and prefixes, define terms that apply to the structural organization of the body, identify the body cavities and the organs contained within those cavities, find and identify the anatomic and clinical divisions of the abdomen, find and name the anatomic divisions of the back, define terms that describe positions, directions, and planes of the body, and identify meanings for new word elements and apply them to understand medical terms. So those are our program learning outcomes or our unit objectives for chapters 1 through 4. All right, so what are we going to do? To begin with, we need to define the terms that apply to the structural organization of the body, identify those body cavities, and recognize which organs are contained within each of those cavities, locate and identify the anatomic and clinical divisions of the abdomen. Those are your quadrants. And then we will also be talking about cells, tissues, organs, and systems. If you look in your book, and I think it's on page 39. Look at page 39 in your book. There is a wonderful figure 2.2-7 about how cells build up into tissues. Tissues have groups of different tissues, and they become organs. Organs work together to become systems. So you start with your cells, and you have different types of cells, and you can cover those as you move through your book. And then those cells build into tissues. The tissues work together to become organs. Organs then work together and are considered part of a system. And your body has many of those. So I'm not going to cover much about cells. I'd like you to take a look at your book just so that you understand those different major parts of the cell. This is a great visual for looking at what are the parts of the cell, what do they look like, and that sort of thing. Hopefully you've had anatomy and physiology already, or at least basic biology, and that has walked you through some of these things. So one of the things you want to do is make sure you understand all of these terms up here: anabolism, catabolism, cell membrane, chromosomes, cytoplasm, DNA, endoplasmic reticulum, genes, karyotype or karyotyping, metabolism, mitochondria, and nucleus. And then it talks about the different types of cells and what they the mission that they carry out. And this gives you a visual example of each of the types of cells. You can see they're very different because they have different functions to carry out. The messages that move along a muscle cell are different than those carried by a nerve cell. And your skin is very different than perhaps a fat cell. So tissues, it talks about how those work together to do a specific job, and how you have different types of tissue then combining to form an organ, and how your organs work together to do specific functions that are more complex. And this is the design or the figure on page 39 that I referred you to that I think will be very helpful. So now we're going to move into the next section about adipose tissue, cartilage, epithelial cells, learning what a histologist is and what they do. Talk about the larynx, the pharynx, the pituitary gland, the thyroid gland, trachea, ureter, urethra, uterus, and viscera. So body cavities are the spaces within the body that contain the internal organs, or viscera. So viscera and organs are meant to be the same. So mentally think, internal organs equals viscera. There are 4 basic ones that you're gonna look at: cranial, thoracic, abdominal, pelvic, and spinal. And this is a really good picture to help you mentally think of those 4 body cavities. So what is in each body cavity? Which organs? And this is another really great visual to help you understand what's in each one. In the cranial, it's primarily the brain. Thoracic, it's your lungs, heart, esophagus, trachea, bronchial tubes, thymus gland, aorta. In your abdominal, it's stomach, small and large intestines, spleen, pancreas, liver, and gallbladder. In your pelvic, it's part of the small and large intestines, bladder, rectum, urethra, ureters, uterus, and vagina in females. And then the spinal is focused on the nerves of the spinal cord. So this gives a quick quiz. I'm going to let you answer it. If you need to go back, do so, but you can do it. And this is another one. Pop quiz, you can do it. If you're not sure, go back and look at your book. So it talks about the abdominal, pelvic, excuse me, and thoracic cavities. What all is included in those? And you can read through all of those different ones. This is a great picture, again, to show you what all those organs are that are in those cavities and point those out to you if you've forgotten where the gallbladder is, or what the pancreas looks like, or where's the colon, or, is the heart on the left side or the right side, and where are the lungs, and how high are they usually, and those types of things. And you can note the diaphragm, or what is that dividing one cavity from another. So this next study section is on the abdominal cavity, cranial cavity, diaphragm, dorsal, posterior, mediastinum, pelvic cavity, peritoneum, pleura, pleural cavity, spinal cavity, thoracic cavity, and looking at the position of ventral. Ventral and dorsal are different positions, and you need to know both ventral and dorsal, as well as anterior and posterior. So make sure that you're familiar with those and you do flashcards. And this talks about the abdominal pelvic regions. There are 9 regions, I believe. Yes, 9 regions. And regions are different than quadrants. So make sure that you pay attention to that. You have 9 regions in between the abdomen and your pelvic area. And this is going to show you where those are located. And you really need to know those because if somebody talks about a right inguinal hernia or a left inguinal hernia or an umbilical hernia, you kind of need to know where that is and what that means. Now we get into quadrants. There's 4 quadrants, and you have your right upper quadrant, your left upper quadrant, your right lower quadrant, and your left lower quadrant. There's 4 of those. And you need to have an idea of what's in those. So make sure that you study that well. And here's a picture to help you kind of identify what's in each of those 4 quadrants. So for instance, if someone comes to you and says they have right lower quadrant pain or RLQ pain, you might suspicion that it could be their appendix or something. But if they're talking about anything on their left side, the appendix isn't over there. This next section is very, very important. And if you are doing really well with other things, make sure you study the positions, directions, planes of the body, because those are things that that you really have to know. The divisions of the back are cervical, thoracic, lumbar, sacral, coccygeal. So make sure that you're aware of those. You have cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacral vertebrae, and then your coccyx bone. And this will show you kind of where that is. And your coccygeal bone is your tailbone, so to speak. Well, between your sacrum and your coccyx bones. So again, going over the abdominal pelvic regions and the quadrants, divisions of the back, in terms that you use, vertebra is one vertebra. Vertebrae is multiple vertebra. So you need to keep that in mind. If we're talking about more than one vertebra, it's vertebrae. So have that difference in your mind. Spinal column, spinal cord, and then what your discs are. And also, really quick, make sure you spell disc correctly. It's not D-I-S-C or D-I-S-K, it's D-I-S-C. So if you're thinking CD, no, it's a disc, D-I-S-C. And this is a quick quiz. I'll let you work on that. And another one. Now, positional and directional terms of the body. This is what I was talking about is so important to learn. And it's easy to get tripped up on these, so make sure that you spend some time on those. Anterior and posterior, deep versus superficial, proximal versus distal. So anterior is your front, posterior is your back. Deep means well below the surface, superficial means surface on top of, that type of thing. Proximal is very close. You think of proximity. Proximal is close. Distal, far away. Inferior versus superior, medial versus lateral, supine versus prone. And I'm going to leave you to take a look at your book for those, because you really need to study those, do flashcards on those, make sure that you're very aware of the differences. This is a great quiz. You may want to come back to it and do it again and again to make sure that you're sure you know the positional and directional terms. Then we get to the planes of the body. You have planes. You have a frontal or a coronal plane. You have a sagittal or a lateral plane. And then there's a transverse or a cross-sectional axial plane. I hear axial, lateral, coronal oftentimes used. Frontal, sagittal, and transverse are also used. Cross-sectional, not quite so much. But you, again, have got to understand what these are. And this gives you a really good view so that you understand. So frontal is everything that's in front of you, the front half of your body, versus so that's anterior versus posterior. Number two is dividing you in half, so it's your left side, your right side. It's your laterality. Transverse is when they cut you in half like you're a magician's trick, and so you have upper and lower. Study section 5 for this nice long chapter that you need to go through. It gives you some more words. Make sure that you know your planes, your positions. And then we're going to get into combining forms and suffixes and prefixes. So we're going to fly through these. And this gives you their meaning, of course. And make sure, again, that you're looking at the combining form, the root as well as the combining vowel that goes with it. And here's more. And still more. I realize this is a lot of material coming at you very quickly, but this is something that we really need as a foundation before we move forward into each body system. And we'll be covering a lot of these again as we go through each body system. For instance, ilium, we will probably be covering when we go through the musculoskeletal part of our book. And this first one is ladder, like lateral, not later, lateral. So you might want to put that in your mind. And still more. And notice this with Thiel or Thiele. You might see those used interchangeably at times. So make sure that you understand that sometimes it's going to be Thelo and sometimes it's going to be Thelio. And still we have more. Now we're into some prefixes. And this is helpful because it gives you the opposites. And notice again, we've got several that mean pertaining to. So the first three, eel, eak, eor, those are all pertaining to. But look at O's. O's can be pertaining to or full of. So you're going to have to notice that difference. And I'm going to skip through the quiz. You can come back and do that and double check your book for the answers. And there we are. We are finished with chapter 2. But there is so much there. Make sure that you really spend some time on chapter 2 because it's foundational for what else you will see. All right, I'll be back shortly and we will talk about chapter 3.